So I'm here with Marsha McAdam at the NHS Confederation Mental Health Network Conference here at the King's Fund, and we're here to talk about the links between mental and physical health and the support available for those. So Marsha, can you introduce yourself?
I'm Marsha McAdam. I'm a service user representative in physical and mental health, and one of them being the recently launched Equally Well campaign. So yes.
Great. And tell us about the support you get for your mental and physical health and maybe how they work together.
So for the last, a few years ago, it was identified that I needed domiciliary care due to my physical health conditions, one of them being fibromyalgia, which is very debilitating, and I have to use a mobility scooter to get round. And so I've been awarded care, domiciliary care for personal care and preparation meals and everything like that. And since then, it has probably been the most stressful time in my life because of the breakdown with what the care provider, which means the domiciliary care, was they took the contract on, but then it was just little bits that then fell apart, and then I've gone through 4 care agencies in 2 years, and now I've not had any domiciliary care since the 2nd of November, and it's now mid-March, and it is really now impacting on my physical but also my mental health.
And we know that mental and physical health are joined up and not things that you can separate out. How does the link between your mental and physical health work for you, and what impact does that lack of support have?
So with fibromyalgia, if I'm stressed, it really flares up on my body, and I also have borderline personality disorder, and if I'm stuck at home, I then sort of self-doubt and criticise myself. So I try and drag myself out of the house by being involved with having a say about services. But I really struggle. Like at the minute, I'm sitting here and under my skin it feels on fire, and there's different areas around my body that there's pain, and that does affect your mental health, and it's just a circle that just goes on, and it's not nice. Yeah.
And we know it's profoundly important that people do get support for mental and physical health together. And we know that you're part of the group that's working with us on Equally Well to really begin to change that and get people to understand the wholeness of people's needs. What do you think should be different about the way services are organised and offered to people?
There's a lot of talk about health and care joining together, and for me, that would be my saviour. Due to having borderline personality disorder, or the label of it, if you complain about something, she's just complaining because it's part of her personality disorder, etc. Never mind that the reasons that I bring things to the attention is very valid, like not knowing from the domiciliary care agency who, this be at 7:30 at night, who's going to walk through the door the next day at 8:30. Also, I'm fine out and about, I may appear confident in that, but when I'm at home, I get really anxious about who's coming through the door, and having people shower you and relationship's really, really important. So, as I said before, I've gone through 4 care agencies in 2 years, and that's because when I try and sort of ask them or hold them accountable, they then pull the contract, and I'm now they're now trying to commission a specialised package for me, and that's soul destroying because I have a label with BPD and that's so stigmatising. But now having a specialised care package, it just hurts.
And there's something about not just the services provided but the way they're provided, and that accepting as normal that you all have a range of needs that require support that responds to that uniquely, but not something that makes you feel that you're somehow different to many other people who are experiencing similar things.
I know that domiciliary care is predominantly, if that's the word, for older people. So it doesn't matter if the carer turns up an hour and a half later, because that person will just be sitting there. But with me, I've tried to improve the quality of my life by getting out and about. So I do have a reason, a purpose to be ready in the morning to go to things. Because if you saw me like I was yesterday with my Medusa hair, and I would sort of, people would be like, oh, that. So yeah.
It's really important with the government plan for social care coming up that they really do consider people of working age as well as people in later life as part of the priority for them.
For me, on paper,
Thank you.
with the borderline fibromyalgia in that what I've been doing recently, service user involvement stuff, and with like the 1 in 4, you know, all the figures, I shouldn't be doing what I'm doing. I due to die earlier and, you know, doing my diabetes and everything. But I have to fight to try and stay alive and have purpose. And if the health and social care stuff could be sorted out, it would mean that I wouldn't have to go through stress all the time. And that it would improve my quality of life. So it's really important that things get done now. The reason that I've wanted to do this is it's not about a blame thing or an organisation or anything. It's about this. I know that there's thousands of people like me that we need to do something about and work together. Yeah.
And there's an opportunity to do that now with social care reform and a spending review coming up. So the time to act is now. Marsha, thank you so much for sharing your experience with us.
Thank you.